Over the last decade, it's become increasingly clear that the world is running out of antibiotics, and if we don't act fast, we're going to not be able to treat people for infections that people think are easily treated. So today is bringing together a whole lot of experts from across the country and from the rest of the world to really see what can we do to make sure that we're doing our part.
It's a very important coming together of like-minded people that understand the challenges that are emerging in society at the moment with bacteria that are no longer susceptible to the kind of antibiotics that we would like to use against them.
My particular infection would have been prevented by antibiotics. I just didn't get them at the right time. They tried to stop the infection, but unfortunately they couldn't. I found myself in the emergency department talking to the emergency nurse about my symptoms. The doctors came to my wife and said that effectively the only chance they thought they had of me surviving was to remove the other 3 limbs that I had. I don't want anyone else to have to go through that situation, or using antibiotics and they're not effective enough. So we really need to be stewards of those antibiotics that we do have.
Unfortunately, we haven't seen a new class of antibiotics developed and rolled out in the last 30 years. So we really have to look very, very, very carefully at how we're using the antibiotics that we've got today.
We want to make sure that when a patient needs antibiotics, that they get the best antibiotic at the right dose for the right amount of time. So now you have a completely healthy person with an infection that might actually require them to be admitted to the hospital. Just being in the hospital does increase your risk of getting an infection, and sometimes that can be a resistant infection.
There have been meetings all around the world trying to develop local, national and international plans for this, and the idea for today's forum is to really try and come together and make some decisions about how we can make a bigger impact for Australia in particular.